Hi there, I'm going to talk a little bit today about a basic set of progressive exercises that I often give to my clients who are struggling with core activation around the spine. As a chiropractor, I do see some quite acute back injuries and chronic as well, so long term. And generally people with back pain struggle to switch on, neurologically activate the muscles that help to lift and support the spinal column. Obviously that's really important in not just being pain-free but also gaining confidence in your movement. And if you watch one of my earlier videos about the hip hinge and being able to move through the hips in order to do bending, twisting activities while keeping these muscles activated, then if that's something you really struggle with, as soon as you bend forward you feel like your back's going to give or go, or it feels weak, then this might be the good place to start for you. So we're just going to run through a basic progression of exercises and see how we get on. So this is often called a dying bug or dead bug track. If you look on YouTube, there's plenty of examples of the dying bug, but they seem to progress quite quickly and quite advanced for people who are really struggling to even switch on the spinal stabilizers. So what I like to do is try and start from the very basics and progress people through as they start to recover, along with other things as advice as well, like ergonomics and just general walking is one of the best things you can do for a back injury. But we're going to start off just going through the dying bug progression. So the first step really, and this can be a bit tricky for some people who struggle to get on and off the ground, but if so, just try it on your bed first. The first step is really just to try and engage the muscles around the spinal column. And I often, it's not a case of trying to really tense your muscles to the point where you can't breathe. All you're trying to do is imagine that you've got an elastic band around your waist and you're actually trying to tense the muscles and actually slightly push that band outwards. And what we're trying to do is increase what's called the intra-abdominal pressure, which then supports and almost lifts the spine and can help with back pain, but also switching on that neural connection again between the spinal stabilizers and the nervous system. It's one thing that a lot of ladies who have suffered, or people with abdominal trauma have suffered, things like cesareans for example, where the abdominal fascia has been actually cut through. That can really affect your ability to contract the muscles around the pelvis and spine, and hence why a lot of people get back pain. So just practice to start with, lying and contracting those muscles, trying to create pressure around the spine, almost like you're bearing down, and just holding that contraction for about 10 seconds and then relaxing. And again, contract and relax. It's almost like you're trying to push your spine into the ground, but you're trying not to flatten out the lumbar spine. Now when you can do that, practice breathing through the diaphragm as well. So one thing you don't want to be doing is tensing and holding your breath. Okay, because that'll just stiffen everything up. So practice doing that. When you get used to doing that, you can actually do that anywhere. So you can do it sitting in the car, standing brushing your teeth, pretty much anywhere. So practice that contraction. You're not trying to get a six-pack, you're just trying to switch on that neural connection. So once you got used to doing that, you can then step up to the next progression, which is actually just to slide your leg out until it's straight and then back. Nice slow movement, and then the other leg and back. You're looking to take about 5 seconds for each leg, and you're looking to do about 10 repetitions on each side. Now if you find that easy, then you can actually lift your leg first and take it out straight. Depending on how good you are at holding this stability, you can either take your leg higher if it's difficult, or if you want to really challenge yourself, you can go low and then back up, down, up, straight, back, down. Or if you're really struggling to even lift your legs because your back is so acute, then you just slide your foot along the floor and back. Look to do about 10 repetitions on each leg, unless you're really struggling, in which case do 5, have a rest, and then do 3 sets of those. Now when you feel confident that you're able to hold this steady and take each leg out straight, nice and slow, so nice slow controlled movement, you can then try lifting both legs off the floor. Now this is a completely different kettle of fish. This is really quite tricky to do if you're struggling with back injury. So you start with both knees up, and you notice I'm holding here just to make sure everything is nice and stable. Hold, leg out straight, back, leg out straight, back, and again you're looking to do that for about 10 repetitions on each leg unless you're struggling. Okay, now the final progression is to add the arms as well. So in this instance, arms up, legs up, and then we take alternate arms down and up, down, up, and again 10 each side. Okay, it's a nice slow movement. What you're trying to focus on is keeping that spine and pelvis stable. You don't want to be arching your back. You don't want to be trying to push your spine into the ground. You just want to feel that it's nice and engaged, your spine's in a neutral position, and you shouldn't get any back pain while you're doing it. Okay, so that's the dying bug track. That's a set of progressive exercises to help you engage those spinal muscles, particularly when you've got a back injury. All right, thanks for watching.